All right. April 21st, movement moment. We're going to start with breathing, just lying. Oh, all of today's thing is lying down, which is delightful. Um, that's not true. There's going to be one part where you walk around a bit. But to start,
I have to move this box then.
please move all boxes that are in your space. And hi, John. And just lie down on the ground. We're going to practice using our diaphragms for breathing. So if you lie down, get cozy. And you're just gonna place your hands at the feel your ribs, have a feel of your rib cage. You notice it like comes in the middle here with your solar plexus, lots of good nerves there, and then it arches down. So find these lower ribs and just put your hands gently on the lower ribs. And I'm gonna give you time. I'm not gonna guide your breath. You breathe however you want. Sort of deeper breaths will be helpful. But what you're going to focus on is really pressing your ribs out into your hands. So you're really using the lateral movement of your ribs, which means that you're then using your diaphragm to breathe. So just start, give you 5 minutes. So start breathing. See how it feels. Less of a belly breath, so try not to really press your belly out like you might in some breath work. Try to really just focus on that lateral outward breathing. That's why your hands are on the sides of your lower ribs. And just check in with your shoulders and jaw. Make sure you're nice and relaxed, even though your arms are in this position. Find a way that your hands can rest gently on your ribcage and your shoulders can be soft. You can sort of notice if you're pressing out more with one side or if one side rises before. It might be very subtle, but sometimes we actually have more movement in one side of our ribcage. And you can work on that. So if you want, you can try to make them even. So if one side is a bit slower, you give that a little bit more pressure and think about more air coming into that lung for a couple of breaths and then settle back to normal and see how that feels. And for the last sort of minute here, if you're not already in this position, just let your legs go straight out. And then bring your arms down by your sides. So leave that, try to keep breathing in the sides of your ribs, but you'll lose the hands on the ribs. So we're just lying flat on the ground. And start to notice what your body feels like. So just do a scan as you breathe. Notice if any particular spots feel like they're sort of heavier on the ground, like you can feel one hip more than the other, or one shoulder blade, there's more feeling. It usually means there's a bit more tension there, or something's different. So just notice those things. Okay, that's 5 minutes. So just stay here. We're actually not going to get up. We're just going to lie here for the whole movement moment. I'll just give you a few more seconds to notice what's happening in your body. Where you might be holding tension. Okay, so then bring your legs to an angle so your feet are flat on the ground and your knees are pointing up towards the ceiling. And we're going to start with a movement that hopefully will release tension in our backs. So what we're going to do, this is all very gentle. So if at any point you feel any discomfort, just come out of it. You don't have to go very far. They can be really small movements as long as you're really focused. So I would suggest keeping your eyes closed for this, just so you can really sort of be in your body. And we're gonna start by just tilting our pelvis forward. So rolling your pubic bone away from your belly, if that makes sense. So you're arching your low back. So just slowly arch, try to keep your abs as loose as possible. So everything in the front, we want to just kind of keep soft, and the back will tense up. So just go as far as you can. It doesn't need to be a big movement, but you're arching your low back off the ground. And then as slowly and smoothly as possible, roll back to neutral. So this is the key, is that you really want to control this movement. Slowly letting your back muscles relax. And it might feel jerky. And that's just sort of where our brains have lost control of how to relax properly, which is why we often feel so much tension. Once you're unrolled and just back to neutral, take a breath, totally relax. Try to just let everything go. And then we're going to do it again, and you can pair it with your breath. So inhaling, rolling that pelvis, arching your back. And when you end range, super slowly rolling back to neutral. Once you're neutral, let everything go, take a breath. We're going to do a few more like that. So if my pace isn't good for you, go at your pace. We'll just do a few more. So breath in as you arch your back by tilting your pelvis. Trying to keep everything relaxed except for those back muscles. And then slowly coming out of it. When you're uncurled, totally relax everything and take a breath. it's important to take this pause in between. And again, rolling up. You might be getting more and more range each time, or it's the same. Just try to notice what's going on. And super, super slowly letting your back relax. And when you're back to neutral, relax everything. Really try to take a breath that lets everything be super soft. And do one more of those. Breath in as you arch your back, starting that movement with your pelvis rolling forward. Abs are nice and soft, they don't have to do anything. And undoing that until you're nice and neutral. Take a breath to be super relaxed. So now we're going to do the opposite side of our bodies. So take your arms behind your head and release your fingers. Don't worry, you don't have to do crunches right now. It's just a mini crunch. We don't have to, there's still not a lot of effort here. So we're just doing the opposite, same idea, opposite movement. So we're going to start by tucking our pelvis back. So scooping, using your abs to just gently bring your pelvis into a posterior tilt. So just the opposite of what you were doing. So you're really flattening your back on the ground. As much as you can, just focus on your abs making that contraction and your back stays soft. And then slowly just try to use your core, lift, tuck your chin in and lift your shoulders up just gently as far as makes sense. You can tuck your elbows forward if you want. So you're ending up in a bit of a crunch, but you shouldn't be making a ton of effort. So whatever your range is, it can be small. And then as slowly as you possibly can, let those abs relax. So your pelvis will start to go back to neutral and your shoulders will go back. Elbows widen and we end up back in our original position. Elbows out wide, everything relaxed. Take a breath in between reps, always really relax. And we'll start again, trying to make it a nice smooth movement. So tuck that bum under, just contracting your abs, bringing your ribs and your pelvis as close together as possible. If you want to tuck your elbows in, you're kind of doing a little sit up, but it's very gentle. And then on your exhale, as smoothly and as slowly as possible, unfurling, thinking about your pelvis as leading the movement. And once you're down, just take a nice breath to relax everything. And again, we're tucking that pelvis under, using our abs. And slowly, just think about the movement really coming from your abs, between your ribs and pelvis. So try to keep your neck and shoulders relaxed as much as possible, as little muscle as possible in the neck and shoulders doing so. And slowly relaxing on your exhale, nice and smooth. If you had any jumpy or choppiness in the first few reps, hopefully that's sort of smoothing out. Taking a nice breath in between, being completely relaxed. We're going to do one last one. So breathing in, tucking that pelvis under, gently lifting the shoulders up with the abs. We're trying to contract our abs here so that they can relax after the whole idea. So you get a nice squeeze and slowly, slowly, with as much control as you can, relax the abs, let the pelvis uncurl, bring your shoulders flat on the ground, elbows out, and take a nice, fully relaxed breath. And then if you'll just go back to original position, so arms by your side, legs out flat, and just, I'll give you a few seconds here to do a scan and see if anything feels different. You can, if you want to put your arm or your hands back on your ribs or not, but really just see how that lateral rib breathing feels now. Maybe it's different. It might feel easier if you were successful in releasing some tension from your abs, which is very possible. I hope it is. Might not work for everyone, but just give that a feel. And then super gently make your way over to your side just to get up into a seated position without disrupting all the calm that's in your body right now. Good morning, everyone. There you have it. So gentle, but hopefully helpful.
It was great.
Thanks, Steph.
Great work.